My name is Dorian Harewood. I'd like to talk about my knee situation. I've been bone against bone on my knees for over 40 years. And started way back in high school. I played football and I tore my meniscus cartilage in my left knee and my ACL, anterior cruciate ligament, in my right knee playing football. There was the knee replacements, options and that kind of thing. I wasn't looking at that because I knew people that had knee replacements and it wasn't that good. I talked to people that had them and they were okay, but it was like they'd had to replace them again. And it was just not something that I felt I wanted to do at the time. My wife mentioned the stem cell thing that she thought, after seeing and going to the seminar, that she thought would really help my knees. And she said, you got to do it. There's no choice. You got to do it. You know, you're barely walking around, blah, blah, blah. And I said, and so I did some more research on the stem cell and said, well, it certainly looks like that is the cutting edge treatment for things like possibly the knee and other things. I think after the consultation with Dr. Shea, I decided to go ahead. Not decided, my wife insisted that I do it, but I agreed with her. So I said, okay, I'm going to do this. But just after a little over 2 months, close to 2.5 months, I'm guessing, my estimation is that I'm 95% pain-free now on my knees. One of the things, it sounds crazy, but when I take a shower, when I get to the point of where I'm washing the soles of my feet, I usually stand on one leg, balance myself, and kind of wash my feet. And with my knees, before this stem cell treatment, my knees I would feel the pain, and I would hear and feel the crunching of the bone, because I've been bone against bone for all that time. So I literally, you'd feel it. And that was one of the first things that I noticed with this, is I didn't feel like, oh, wait a minute, why is it not doing that? Even, I don't even hear it, So I started thinking about that and noticing that when I would do it on both knees, and both knees are different, they had different damage done to them. But that was a big, big improvement and it was directly because of this stem cell therapy. So then I noticed that after I was able to start walking upstairs and walking up and downstairs, I usually really take it easy, and I forgot that, I didn't forget, but it's kind of been a protective device for me. I'm going upstairs, so I got to take it easy because it's going to be painful, it's going to be this. And I noticed it wasn't painful, and I was able to walk upstairs. I haven't tried running upstairs, but just walking upstairs, I didn't have the creaking, I didn't have the pain. I don't know how else to say it except that the pain is all but gone in my knees. And I've been told by Dr. Shea and Floyd that it's going to get better. So I'm extremely excited about that. And it's all because of my wife having come to RejuvaYou, having done stuff with RejuvaYou before for years, but then finding out about this stem cell treatment that could help my knees. And if it weren't for them, I wouldn't be here talking about this now. And I'm excited to and look forward to my knees continuing to develop. These cells that they put into my knees are growing, little baby cells, they're growing, and I think if I go back to that place that looked at my knee and said that I was bone against bone, they'll probably look and say, well, what happened now? You've got something there, whether it's cartilage, I don't know what it is, but the padding is now there and the pain is gone. I can feel that it's not rubbing bone against bone. It's extremely exciting. I was bone against bone for 40 years, and had given up any ideas of doing anything with my knees, just hoping I wouldn't have to get into knee replacement, but just dealing with the pain of being bone against bone for all these years, these decades. And now I'm not. I'm not having to deal with that pain. I'm looking forward to pain-free knee movement and more stuff. I don't know what I'll be able to do, but I know that I will slowly start trying to do other things. I may even get back to playing basketball. I don't know that I will, but I do know that it's now a very good possibility. So thank you, RejuvaYou, for getting my knees back the right way. And thank you, Dr. Shea, for everything you guys have done and continue to do for these knees of mine.